Pericardial effusion. A pericardial effusion is detected on plain X-ray only when 150 to 200 ml of fluid is collected in the pericardial cavity. The heart shadow is enlarged and all the notches are blunted out, giving a smooth flask-like appearance termed as a leather bottle heart. The heart border is very sharp as the movements of the heart pulsation are blunted by the fluid, but the cardiophrenic angles are sharp and acute, unlike left ventricular hypertrophy. The cardiomegaly is massive with large amount of fluid collected in the pericardial cavity. Now see this X-ray with a massive pericardial effusion. Note the globular or leather bottle heart. Note the sharp and stenciled heart border. Note that both cardiophrenic angles are acute. Compare the obtuse left cardiophrenic angle in left ventricular hypertrophy with the acute left cardiophrenic angle in pericardial effusion. Note again the left cardiophrenic angle in left ventricular hypertrophy and the acute angle in pericardial effusion. This is another X-ray showing a large pericardial effusion. Note the typical flask shape, sharp stenciled heart borders, blunting of all notches, acute cardiophrenic angles, and reduced pulmonary vascular shadows.
For more such stuff, do subscribe to Date with Medicine.